Good afternoon. Welcome to today's live. I'm trying to monitor something here. So in case you see me looking down. So I just thought to come live to interact with us briefly today, being a weekend. Please introduce yourself once you join this live, and I will be sharing some important information with us today. If you see me looking that place, I'm trying to monitor something here. Please kindly introduce yourself in the chat box and where you are watching me from once you join this live. Thank you. And let me ask a question right now. How are you preparing for the festive season, for the festivities? We are in December, and December is like a period of time where food is surplus, drinks are surplus, even when you don't want to eat. You see people that will invite you, and when you are too bottled up, you'll be like, what is it? Better eat, do this, do that. So what are the measures that you are putting in place? And of course, you should know that this period is a time that you shouldn't let your guard down if you have blood sugar issues, because if you are not careful, a little sleep here and there, oh, it's just a small bowl of, it's just a little wine, it's just, before you know it, it will compound, and then what will happen? It will affect your blood sugar negatively if you are not careful. So this is a time where you have to be extra careful about what you eat, about what you drink, because they can be sneaky during the period of Christmas and New Year celebration. It just comes, like, it's like, oh, let me just indulge a little. Before you know it, it has Clara Ololaimo, you are welcome, ma'am. So it's like, once you just let your guard down like this, a little, everything has gone overboard, has gone beyond control again. And let me tell you, this is a point whereby a lot of people, their hard work that they have been doing since January, this is when it goes down the drain. If you are diabetic, if you are pre-diabetic, and if you are insulin resistant, if you are not careful, all your efforts that you have been putting in place since January, they can go down the drain in this December period if you are not careful with what you do. You have to, so this is a period where you have to really, really plan yourself. This is a period where you have to be proactive. Yes, you have to plan ahead and look for ways to curtail the situation. And you really have to be careful about what you eat, what you drink, how you live your life, your lifestyle in general at this period. Please introduce yourself in the chat box and where you are watching me from. I want to know you if you are joining this live. Thanks so much. So, as I was saying, you have to really, really, really be careful and plan ahead. So, what are the things? I want this session to be interactive, although I still want to do a little bit of teaching during this live session. But first, I want it to be interactive. What are the things that you are putting? What are the measures that you are putting in place to make sure that all your efforts in January don't go down the drain this December? To make sure that you still maintain a good and healthy blood sugar levels during this festive period. I want to know, what are you doing? Or have you not started doing anything? You have to plan ahead. That's the essence of what I've been saying since. Please introduce yourself as you are joining. And in a short while, I will be teaching on some that you have to do if you are diabetic or you are pre-diabetic, that you have to do a lot. It's going to save you a lot. It's going to, in fact, it will go a long way to lengthen your years. So please, it's only Clara Ololaimo that I have seen introduce herself in the comment section. Please do so. I want to know you. I want to get to know you. Also, if you have any questions for me, this is a time for you to ask, and let me, answer briefly before we go into the live session proper. This I'm trying to monitor something here. So if you see me looking down, don't bother about that. It's just an impromptu live. I just said, oh, let me come live today. Today being Saturday. It's not planned, but I believe it's a whole lot of good. It's going to do us a whole lot of good. So once again, I ask, how are you preparing for Christmas? How are you preparing for New Year? And what are the things that you're putting in place to curtail the situation, to make sure that your blood sugar doesn't go haywire during the period? And also, let me use this opportunity to talk about there's a particular class that I was supposed to hold this evening. Before I talked about it for a few times on my community tab, but I believe that a lot of people didn't see it at that particular point. So I'm saying it again. We are postponing the class. We are postponing the class to next week Saturday, which is 13th of December by 5 p.m., whereby I would be teaching about um, 20 different ways in which you can cook or prepare your meals as someone with blood sugar issues to prevent blood sugar spike. So if you are interested, you can comment interested in the chat box, or you send a WhatsApp message to me. Go through my community tab, you will see my WhatsApp number there. So also check my community tab, you will see the flyer there, the community tab for this channel. So you see the flyer there and all the details you need to know. So if you are interested in registering for the class, please write on the flyer that I uploaded on my community tab, comment interested there, or you send a WhatsApp message to the number there, and let's take it up from there. I believe it's a very important class that you don't want to miss for just a token. It's a very important class. I believe it's going to help you really, really. It's going to be really, really helpful, especially during this festive period. If you attend the class and then you get the teachings on how you can, prepare your meals during this period to prevent a huge um blood sugar spike, I believe is going to be helpful for you and for your diabetes remission journey. So once again, if interested in the class, in the online class, please go to my community tab and check. You will see the flyer there. That was still the last thing I uploaded on my community tab. Okay. So you are welcome, David. You are welcome. Let me know where you are joining from and your name. Just introduce yourself briefly and where you are watching me from. So, not to waste much of our time, I want this live session to be brief and I want it to be short. So, we will be talking about 6 different blood tests that you're supposed to do as someone that is diabetic, that is pre-diabetic, especially if you are in Nigeria. So the reason I'm hammering on this is the fact that in Nigeria, they don't just, I've studied this pattern that they don't just, doctors don't just write this test for you to go and do on your own, except, except you. Okay, Clara Lowolaimo, please go to my tab, go to the post section. When you open this, click on this handle, you will see videos, you will see playlists, you will see posts. Click on the post aspect of it. When you see it, you will see the flyer about the class that I uploaded. My WhatsApp number is there, so you can get it through that flyer and send all the information about the class is on the flyer. So you can just get my number, then send a message to me. So I don't get you, MDC. And what do you mean? What do you mean as time? I don't get it. Bernadette Obi, hello, you're welcome. What happened to my lips? What happened to it? Nothing is wrong with my lips. I don't know what you are seeing on your side. I applied lip gloss on my lips. So what are you saying over there? Nothing is wrong with my lips. Okay, so like I was saying, so this test I will be talking about and advising on you to do this period, especially if you are in Nigeria, is I will be listing them. So they are very important. If you are in other countries, maybe I don't know, maybe they order it as part of the routine test. But if you are in Nigeria, they don't really, they don't, doctors don't just tell you to do it um for you out of their own volition. You have to really request for it. This I'm trying to keep up with something here. If you see me looking down. So back to what I was saying. So the first test that you should be doing is um, HbA1c. I know all of us, or most of us, we are already conversant or we've heard about this test before. This is not the first time. So what that just does is to give you um, a 3-month average of what your blood sugar looks like, so that they get to know your doctors or your physician or those that are managing your health can have it's like a compounded knowledge about how your blood sugar readings have been over the last 3 months, to know where you are. And when you do this, you'll be able to know, maybe, okay, you are in the pre-diabetic range, you are in the diabetic range. You want to know how insulin resistant you are. That's just the point of the HbA1c. So if you have not done it before, or you've not been doing it, I advise that you do it regularly. Do it every 3 months, so that you know whether you are improving, whether your blood sugar levels are improving, whether you are becoming more insulin sensitive. Maybe you are still where you were 3 months ago, or maybe you were even worse. Maybe you were even, because if you don't take care of yourself, there is a tendency that the numbers will keep climbing up, which is not good. So this will help you to know, when you have poor blood sugar control for a long period of time, when you have uncontrolled high blood sugar for a long period of time, it's not a good thing, because it can lead to a point whereby it starts affecting your kidneys, your heart, the nerves in your body. So, but when you do this test regularly, this HbA1c, it helps you to know exactly how you are faring. Okay, so that's the first test. So if you have any question regarding diabetes reversal, please put it in the chat box. Put it in the chat box. Only questions related to blood sugar control and diabetes control. Thank you. If you are just joining, please don't forget to introduce yourself and where you're watching from in the chat box. Thank you. Now, moving on to the next text, which you have to do. Bernadette will be. Okay, Bernadette, I've replied you when I saw your comments in one of my videos. I replied you that you can either get it through my YouTube bio. There are some links there that you can click on to get the meal plan, or you send a message to me on WhatsApp. I've replied you, I think, since last week. So please do that. You can get across to me through my WhatsApp number. Thank you. So the other test that I'll be talking about today is first your fasting insulin. Fasting insulin test is a test, the blood test that you do when you've not eaten. So it helps to tell us the amount of insulin that your body is producing after you have not eaten for a minimum of 8 hours, which is in most times overnight. So the fasting insulin, the fasting blood sugar is please check my post. Check under the post, Bernadette. The post section. When you click on this channel and when you see my page, you see posts, you see videos, then you see playlists, then you see posts. Please click on the post aspect. As a matter of fact, I uploaded a flyer a few days ago. My WhatsApp number is there, so you can get it from there and get across to me. Thank you. So, the test that we are conversant with is what we call fasting blood sugar, which you do every morning. So, this fasting insulin is also like it, but just that this time around, the test is measuring your insulin levels. The test is measuring your insulin levels, how much insulin your body is still producing over the course of 8 hours. Okay. If you have any questions related to blood sugar, um, diabetes control, please feel free to ask me. Feel free to type it in the chat box and I will be replying you. So I think I've mentioned two tests. So the third test that you should do is the lipid panel. And the lipid panel is, in layman terms, in simple terms, it just measures your cholesterol levels, the amount of the good cholesterol you have in your body, and the amount of the bad cholesterol that you have in your body. So, as a diabetic, you want to be really, really mindful of the amount of cholesterol. Of course, your number of good cholesterol should be more. Why? You shouldn't even have a bad level of bad cholesterol. It should be very, very low. It should be normal. You should have a high level of good cholesterol. And as a diabetic, if you have if your level of bad cholesterol is high, that is not a good sign. And one of the things you can do to curtail this is to limit your intake of saturated fats. Saturated fats are found in foods like oil, majorly oil, butter, processed foods that you eat. So if you are the type, maybe after doing the test, you have done the test and you discover that you have um, a a high level of bad cholesterol, you will have to be really, really mindful of the amount of saturated fat you do. But you won't even know anyway if you don't do the test. So that is why it's very, very important. Because as a diabetic, if you continue to have a high level of bad cholesterol, that is, you are writing letter to heart disease, which you don't even want to have a comorbidity. What do I mean by comorbidity? Comorbidity is that you are treating one disease, but as time goes on, other diseases are joining on the ground, which you are not even aware of as a result of that first disease. In this case, initially you presented with type 2 diabetes, but along the line, you didn't pay attention to your diet, you didn't pay attention to what you eat. Now, you are now having a high level of bad cholesterol, leading to blocking of arteries, leading to heart disease. So now, apart from diabetes, you are not treating heart disease or you are not treating hypertension with the diabetes. That is comorbidity, which you want to stay clear of. You really have to be careful. So that's why this particular test is important. So after doing it, it can help you to know what to do as intervention, how you can improve on your diet. And as usual, if you are diabetic or you are even hypertensive, um I have it done for you already, meal plan. You can check through the links in my YouTube bio. They are there. You can get any one of them if you want to reverse diabetes, pre-diabetes, high blood pressure through your diet. There are meal plans that have been formulated for you, which when you follow, you are definitely going to see results. You can get any one of them if interested. This is for those that are tired of relying on medications, because, as I would always tell you, medications will do nothing for you. What they will do is to mask over your symptoms. You feel, oh, it's getting better. The moment you stop the medications, your problem returns. In fact, before stopping the medication, it will get to a point whereby, okay, you were using 250 milligram before. Now, that 250 milligram will no longer work for your body again. Then the doctor will have to increase your dosage to 500 milligram, because we've already developed what's it called, resistance to that 250 milligram. It's not doing the work again. They will increase your dosage to 500 milligram. After a few months, some a few, it's not even up to years. After a few months, after 1 year, your body, that 500 milligram is no longer doing the work that it's supposed to do for your body again. They will increase it to 750. I see this in a lot of my clients. They tell me this. This is what I've seen. I'm not talking. I'm not just talking on my own. After a while, that 750 is not working for your body again. That's how you know that drugs are not the solution. That's why I preach radical lifestyle change and dietary change for you, for a lifestyle disease, or for lifestyle diseases like diabetes and hypertension. Once you change your diet, you are going to see it's not a matter of you chewing pills up and down. Type 2 diabetes, I'm not talking of type 1. Type 1 diabetes, you have to keep on using insulin, because the problem is not even from you, it's just how your body, your system is wired. But for type 2 diabetes, which is majorly a lifestyle and a diet disease, you will get your healing also when you make changes, radical changes to your diet and your lifestyle. So if you are interested in any of the diet plan, you can get it through my YouTube tab. The links are there, or you send a WhatsApp message. My number is in the post, the last post I made on my community tab. Thank you. So I've mentioned 3 tests now that you need to do as a type 2 diabetic or insulin resistant, and you are in Nigeria. I said the first one, HbA1c. The second one, I mentioned fasting insulin. Then the third one, I talked about cholesterol. If you are just joining me, you are welcome. Feel free to introduce yourself in the chat box. Tell me where you're watching me from. And I'm more than glad, I'm super glad to welcome you here. If you have other questions also to ask me, if you have any questions to ask me relating to blood sugar control, diabetes management, and all that, feel free to write it in the chat box and I will be answering them. Okay? Thank you. Then, the fourth test I will be talking about today is what is called the GFR. This GFR is just your glomerular filtration rate, and it deals with your kidneys. This particular test is something that I advise all my clients to do, particularly those that have been, diabetic for a while, for some years now. It's very, very important, because it's going to show you how well your kidneys are working, how well your kidneys are filtering waste products. It's going to show you how well your kidneys are working. So you really, really have to, this is a test you have to be serious about. Go and do it. Kidney function test in general, they will show you your GFR, which will show your GFR, how well your kidneys are working, how they are filtering waste products, urea, everything is included there. Also urine to albumin creatinine ratio. Do everything. Just request for a kidney function test, because diabetes, diabetes and hypertension are the two leading causes of kidney failure. And if you are a Nigerian, you don't want your kidneys to fail. You really don't. I think you are in a developed world and all that, you have access to great healthcare, that even if you have what's it called, issues with your kidneys, you are sure to get good what's it called, good medical assistance and all that. But as a Nigerian, you can't afford to play kites with your life and with your kidneys just because you are diabetic. Please go and do this test so that you know how well your kidneys are working, because poorly controlled blood sugar or having diabetes for a long while, up to 5, 10, 15 years, can, start having adverse effects on the nerves in your kidneys, start damaging your kidneys slowly. And kidney disease now is now rampant in Nigeria, unlike before. You see young people coming down with kidney disease. You see even people that are not diabetic these days, they are not hypertensive, they are coming down with kidney disease. Not to talk of those that now have a particular illness like diabetes that predispose you, that increases your risk of kidney failure. So this is a test you want to do. You want to be doing it. I advise that you do it twice in a year if you are diabetic, every 6 months, to be on the safe side. Do it so that you know what, and you know how to start taking care of yourself, and all the what's it called, necessary precautions to be taken. So this is very, very important, and this is an important test. In case you see me looking down, I'm trying to do something here. I'm trying to do something here. So I think that's four, if I'm correct. So Ireoluwa Farm Feeds Foods. You are welcome. You are welcome. So we've been talking about important tests that you need to do if you are diabetic or pre-diabetic in Nigeria. But mostly if you are type 2 diabetic, these are the tests you should be doing regularly. We've talked about HbA1c, we've talked about fasting insulin, we've talked about cholesterol, then we've talked about kidney function tests. And now I want to talk about the fifth one. I said I will mention it six in this live stream. So the fifth one is vitamin D. You know the mistake a lot of us make. Please, can I get your YouTube link? No, is this Bernadette? Please, is this link now? Just click on Beat Diabetes Nigeria. It's going to, once you click there, go to that welcome page. Just click on the upper part of it. Welcome to Beat Diabetes Nigeria. There are some things there, like an intro about what this channel is about. So once you get there, you will see the links for the WhatsApp number. Go to the post. Please go to the posts. Excuse me. Okay, all right. So, as I was saying, the fifth one, vitamin D test. You really have to do this. You know, the mistake a lot of us make is that we think, oh, because we are Nigerians or we are Africans, and then we know that yes, there's a lot of sunshine here. But research has shown that despite Nigeria being a country with a high level of sunshine, where we are exposed to sunshine on a regular basis, people are still deficient in vitamin D. Excuse me. People are still deficient in vitamin D. And low levels of vitamin D have been linked to insulin resistance. So this is a test you want to do. Try and check your vitamin D levels, and after checking you realize that you are low, please, that means you have to start supplementation. Yes, you have to start supplementation. You have to start using supplements, vitamin D supplements. Yes, you have to start using vitamin D supplements to increase your levels, which will help your diabetes control and blood sugar control. Then the last test that I'll be talking about today that I have to do is cortisol test. This test just measures the level of stress in your body. So I want to believe that we know, or if you didn't know before, I'm telling you now that when your cortisol level when your cortisol level is high, then you it makes controlling your blood sugar harder. So that's why I advise my clients that if you want to um if you want to manage, I don't like using the word manage. If you want to reverse or control diabetes, you have to make sure that your stress levels are very low. Learn to manage your stress very well. So once you do this test and you discover that your levels are high, you have to look for natural ways of lowering your levels. Avoid everything that increase, you know, them all those activities that increase your stress levels. Learn to avoid them. Learn to do things like meditation. Learn to not do not press your phone close to bedtime. Manage stress. Ensure that you are sleeping properly and adequately at least 7 hours every night. All these coupled with your diet is going to help you to beat diabetes. So there you have it. These 6 steps are important. Try to do them. They are going to help you in your diabetes control journey. They are really, really going to help you. So there you have it. If you have any questions, because I don't want to take our time in this live, I plan that it's just going to be for 30 minutes, just breathing here. So earlier I talked about the importance of you planning ahead of this festive season and learn how to plan yourself, manage yourself, be proactive so that you don't experience a huge spike during the Christmas, during the celebrations. Because as a diabetic, you really, really have to be, mm, you have to be ahead. Yes, you can't just take chances with your life. You can't take chances with your life. You have to be proactive. You can't eat anyhow the way others are eating during this period. You can't drink anyhow. You can't drink anything. So it's a lot of work. I will not lie to you. But once you are proactive, I'm assuring you it's going to be easy. So like I said earlier, if you are still joining, check the post section, the community tab, and look at the last flyer. So if you are interested in the class that will be holding next week Saturday, whereby I'll be teaching you 20 different ways to prepare your meals, especially you need it during this period so that you can eat during this festive period without spiking your blood sugar. All the details to register, they go through it, then get across to me on WhatsApp so that you can register. Also, if you wish to work with me one on one to reverse diabetes totally, so that you don't keep on, just masking over the symptoms and managing it, you want to reverse it, also get across to me. Let's work together and let's take it up from there. Thanks so much for watching. If you also need a meal plan, get across to me, or you get it through the links in my YouTube bio. Different types of meal plans are there for you already. So thank you so much for joining this live. Have a great weekend, and I will see you in my next live. Thank you.